Hi everyone, so my name is Debbie Nguyen and I'm the community educator for the hepatitis-B program at Cancer Council New South Wales. So my hat though for this project was really project officer for this liver cancer resource. So I'll be presenting today about the multimedia information program for people affected by liver cancer, and this project was funded by Cancer Australia as part of the Supporting People with Cancer grant initiative. And the chief investigator for this project is Monica Rabotin, the medical director of Cancer Council New South Wales. So this busy slide, our first graph, go back. Okay. So our first graph, as you can see, just to give you, sorry guys, to give you some background, primary liver cancer in New South Wales. So if to look at the first graph there, this is a report from the Cancer Institute, incidence and mortality report. And you can see that the incidence for most cancers is decreasing, except for 3 cancers, which is pancreatic, lung cancer and liver cancer. And liver cancer is the very tall one you see there. So liver cancer rates are increasing between 1999 and 2008 by 95.4% for females and about 50% for males. And the graph on the right you see there is survival. So the relative survival, you can see the circle down the bottom there is around where liver cancer is. So not only is it increasing in incidence, but the mortality is also increasing. And to give you some background, so HCC, hepatocellular carcinoma, it's increasing in incidence or mortality, as I've been saying, and about half of diagnoses occur in migrants as well. So, and there's also a lack of resources for these migrants who are diagnosed with liver cancer in other languages and that are not in English. And there's also a lack of research as well into the information needs of patients and their carers. And this project consists of 3 stages. We're up to about we're just finishing stage 2 now. So stage 1 is identifying the information needs, and we did this through focus groups with Cantonese, Mandarin and Vietnamese communities, and also in English as well. And stage 2 is when we develop the resources, and that was informed by stage 1. And stage 3 is, of course, distribution. So in identifying the current information that's available, we did conduct a review of what's out there in Vietnamese, Chinese and English. And what we found was, of course, there's some really good resources out there, brochures, web pages, and they're in English. And some of them are translated into Chinese. But a lot of these are from overseas and from the UK, from North America. And there wasn't so much in-depth information available from within Australia, and especially not very much in Vietnamese. There are web pages from Vietnam, but you can see how that could be a problem for someone if you wanted some support with your cancer diagnosis. You wouldn't know where you could get some local support. So as part of our community consultation, we conducted 4 focus group discussions. 2 of them were in English, 1 in Mandarin and 1 in Cantonese. And we also conducted some in-depth interviews with people across the board, but Vietnamese was completely conducted in interviews. We had a lot of challenges in finding participants. As I was saying before, that it's a high mortality cancer, and a lot of patients were very sick, and some would have to pull out, or if some patients just found it difficult to commit to a time to go to a focus group, and found it easier if we would conduct the interview over the phone rather than asking them to come in. So these are the content areas that we developed that came out of the focus group discussions and our research. And the interesting thing about the focus groups is the differences between the Vietnamese and Chinese communities. With the Chinese, we found a lot more emphasis on in-depth information about their diagnosis, but also about emotional support. A lot of our Chinese participants, they said, I want to know how I can find some support because of the way I'm feeling. But we had less emphasis on that with the Vietnamese community, because the Vietnamese community would say, I go to my family for my support. but wanted more. They wanted to know more things about practical support, like, you know, I have to ask my kids to drive me to treatment, or, you know, I'm finding it financially hard as well. So out of the focus groups, we produced a DVD resource, and there's 10 modules as part of this resource. And the 10 modules were about liver cancer, screening for liver cancer, diagnosing liver cancer, and then 3 modules about treating liver cancer, which were surgical, non-surgical treatments, and disease and treatment complications, complementary and alternative medicine, the liver in health and disease, and that was about hepatitis and its link to liver cancer. And then we had another module with more in-depth information about hepatitis-B as well. And number 10 was support for people with cancer. And each language had 10 modules, and when you total the whole thing, there was about 50 questions for each language. So you can imagine how many films we had for this. This is what it looks like on our website at the moment. The English is up on our website, but the Vietnamese, Cantonese and Mandarin are still coming. So the production of the resource involved filming doctors, you know, GPs, specialists, surgeons, nurses, researchers, all about liver cancer, of course. And the films were divided into 50 questions about cancer and scripted as well, so that there was some consistency and to make sure that no jargon was used and it was in understandable English, really, or understandable language. And the scripts were reviewed by experts and consumers as well. And this was done at Westmead Hospital, RPA, and the Liver Clinic at Royal North Shore. And because I was taking part in this, I've got to say that there's nothing more awkward than sitting in front of a doctor who's speaking to you in Chinese while you're filming him, and you want to let them know that you're listening and supporting them, but we both know that I don't understand what they're saying. So, as part of these films, we did 2 segments about hepatitis B because we found that they were relevant specifically for our communities, because there's high prevalence of hep B, and many people who had liver cancer were there as a result of their hepatitis B infection. So this was particularly relevant for us because we thought it's important to educate these people about this because their family members were also at risk then, and, you know, anybody who's in close contact as well. So this is our resource order form, really, and I have a whole pile of these that I'd love to get rid of. So if you'd like to order a copy of our resource, this is a reply paid postcard. You don't even have to pay for postage. And yeah, so you can order it, and it should be available within the next couple of weeks. We'll be producing DVDs. So they come in 4 separate languages. You get to order your specific language because we wanted to make it as relevant as possible. But if you can't do that, it's also going to be available online, and the website, which is written on the postcard as well if you want to take a copy, is livercancerinfo.com.au. That would give you the link to all the films, every language as well. I'd like to acknowledge the participants in our focus groups who gave us their time, you know, and their opinions, and also our consumers on our steering committee, Mrs. Ella Lee, Lon Nguyen, and Jenny Berryman. These were our consumers who were each touched by liver cancer in some way, and were involved in our project from beginning to end. We consulted them right from the beginning stages of what we planned to do, and then also when we came out with the draft films as well, we asked them to watch them and make sure that they were appropriate. And also Ming Lo Zay and Han Nguyen, who conducted our focus groups, and our expert panel and in resource development as well, and all our logos at the bottom there. Can Revive, our Chinese cancer organisation, who helped us a lot as well, and TCRC as well, and of course Cancer Australia. We've also got this Understanding Cancer in the Liver booklet that Cancer Council has, and we're looking at producing in-language resources, but that might be a project for the future, not for right now. Thank you very much.